Hello, I'm Dr. Yee Ruixiang, a consultant pediatric dentist at the dental service at KKH. Today, my talk is titled Happy Mouth, Happy Smile, Happy Child. The mouth is a part of the body that is often overlooked. Hence, this talk will share some tips on how you can take care of your child's mouth and teeth from birth. Some housekeeping rules and disclaimers for you all to read before I proceed. We'll be covering some of these topics, including the stages of tooth eruption, what is tooth decay, what is gingivitis or gum inflammation, how to keep your child's teeth clean, how to eat well for healthy, strong teeth, and when to start visiting the dentist. First up, the stages of tooth eruption. The child's first set of teeth are primary teeth, also known as baby or milk teeth. Children should have 20 baby teeth in total, 10 on the upper jaw and 10 on the lower jaw. These teeth start to come into the mouth from around 6 months old onwards up till they are 3 years old. However, every child is different, so there can be some variation, and some children may be faster or slower in development. At about 6 to 10 months old, we'll see that the first few teeth start to erupt. And by 2.5 to 3 years old, a child would have the full set of 20 primary teeth. Typically, children's teeth drop gradually and change to adult teeth from 6 years of age till they are 12. This means some of the baby molars have to last till they are 12 years old, so please take good care of them. Many parents are aware that their children's front teeth will start erupting as early as 6 years old. However, some may not know that around this time, the first permanent molars will also come right behind the last primary molars, as demarcated as by the yellow arrows above. This means you will not notice any shaky baby teeth at these areas, as the adult molars would erupt without any predecessors. So it will look something like this in the mouth of a 6-year-old, erupting permanent incisors, replacing the baby incisors at the front, and adult molars erupting behind the second baby molars. This means that these adult teeth have to be taken care of at a very young age, as they are to last a lifetime in your child's mouth. There's a saying that goes, nature only gives us 2 sets of natural teeth, and for the 3rd set, you will have to pay the dentist. So please take good care of them. Contrary to the wrong popular beliefs, baby teeth are important. Healthy baby teeth help your child to eat, speak, and smile. They also maintain the spaces for adult teeth to come out properly. Keeping them healthy will also prevent tooth decay, toothache, gum diseases, and allow your child to form good habits early in life, which will last them throughout their lives. Finally, it is more costly to treat when there are already dental problems such as decay, as compared to having regular dental checkups and good home care for your little ones to prevent any diseases in the first place. Next, we'll look at tooth decay, which is one of the most common childhood diseases. If you think we have good oral health and awareness in Singapore, think again. Early childhood dental decay affects half of our Singaporean kids, and almost 40% have the severe form. Some of you may ask, what is tooth decay? The human mouth contains many different types of bacteria, forming plaque over time. These plaque bacteria convert the sugars and carbohydrates in food into acids, which may eventually damage the tooth surface, creating cavities. This picture shows how healthy teeth and gums should look like: white shiny teeth and shiny pink gums. From 9 months old, most of the front baby incisor teeth would have been erupted, so lifting the lid allows you to examine the teeth for any tooth decay. If there are any issues, then please visit a dentist earlier. If not brushed well, and especially with frequent sugary food and drinks, then the teeth may have tooth decay over time. Tooth decay has various stages. In its early stage, tooth decay will appear as white spots or bands on the tooth surface. After that, it may progress to visible yellow or brown holes on the teeth. It is a misconception that if there is no pain, there is no problem. No, the absence of pain does not mean there is no decay. By the time there is pain, the decay would likely have progressed quite far. In very serious cases, most of the tooth is broken down, and you may sometimes see swellings or abscess appearing at the gum, and your child may even develop a large face swelling. The following are some risk factors or the children at risk for dental decay or other dental issues. These include frequent sweet snacks between meals. Bedtime feeding is also a risk factor, as the food or milk stuck onto the teeth overnight can have a lot of time to create havoc in your mouth. The lack of fluoride exposure to teeth, such as using a good fluoridated toothpaste. Children or siblings with current or previous tooth decay, children or their siblings requiring dental treatment, including treatment under general static or sedation, children at a social disadvantage, children with medical conditions such as heart conditions, diabetes, cancer, children with special healthcare needs such as those with learning disabilities, trisomy 21, or commonly known as Down syndrome, and autism spectrum disorders, and so on. Particularly for children with special healthcare needs, we strongly encourage you to bring them to see a dentist early in life so we can work on prevention and acclimatizing them. For instance, children with autism spectrum disorder, they may have a strong aversion to strangers or a sense of heightened oral sensitivity. Hence, we also have a social story of the dental visit that we can give out to parents. Parents can read to the child and form a routine to acclimatize them slowly to us as well as the dental clinic. We try to keep to the same team of staff if possible so that they will recognize our faces over time, but often it may involve many visits before they can get used to us and the routine of seeing the dentist. While some tooth decay may not present with pain, if tooth decay is not treated early, your child may likely experience pain while eating or sleeping. Sometimes it can be so painful that you will need to bring your child to the hospital. Most teeth with severe dental decay will need to be taken out, and your child will have missing teeth earlier than the others. They may sometimes affect future permanent teeth positions and cause crooked teeth. Next, we'll be sharing briefly on another common condition, gingivitis or gum inflammation. If not brushed well or frequently enough, there will be a buildup of plaque bacteria and even the hardened yellow stone-like looking tartar near the gums. This leads to gingivitis or gum inflammation, which can present as red, puffy, inflamed gums. It tends to bleed when brushing. Sometimes there may be discomfort, but not always the case. Such early gum problems may progress to advanced gum problems over time. To resolve this problem early in time, brushing along the gum line is advised. However, if problems persist for more than a few days or if child have other symptoms, then please book an appointment with a dentist. I'll now share on how to keep your child's teeth sparkling clean. But first, mummies, take good care of yourself. Studies have shown that perinatal period plays a crucial role for the well-being of pregnant women and the health and well-being of their newborn children. Mothers' poor oral health is associated with poor oral health of their offsprings. So please take good care of yourself. You deserve it. Now we'll explain how to keep your child's mouth clean from the day one of his or her life. From birth, you can use a piece of gauze or damp clean cloth to wipe their gums, cheeks, and tongue at least twice a day. Once you see that they have teeth, you can start to brush their teeth with a small-headed bristled toothbrush twice a day. Parents should continue to brush their children's teeth for them until they are around 6 to 7 years old. When they are older, they're able to hold the toothbrush better. It is then okay to let your child practice brushing on their own, but be sure to check and help them as they may not be able to brush all teeth surfaces adequately just as yet. After brushing at night, do not give your child any more food and drinks except for plain water. as the remnants will stay on the teeth the whole night and put the teeth at great risk of decay. Parts per million, or ppm in short, refers to the concentration of a substance. And in this case, the important component in a toothpaste is the fluoride. Generally, we would want to select toothpaste containing fluoride of at least 1000 ppm, as studies have shown that this is an effective concentration to protect teeth against decay. Note that the age recommendations labels on toothpaste can sometimes be confusing, and therefore I would advise to take a look at the fluoride concentrations in the ingredient list of the toothpaste that you are buying instead. For children under 3 years old, if there is risk of tooth decay, then generally a rice grain size of toothpaste is recommended. If you're concerned they cannot speak as yet, some parents like to use a wet cloth to wipe off any excess toothpaste after brushing. For children under over 3 years old, please use a pea-sized amount of toothpaste. Of course, if in doubt, especially for the younger children, do ask the advice for a dentist for advice tailored to the child. Parental supervision is important to regulate the amount of toothpaste dispensed and reduce risk of accidental swallowing. Now, where and how long to brush a child's teeth for? You need to brush all teeth that you can see. You try to brush them systematically from left to right, all the upper teeth, then followed by the lower teeth. Should cover all surfaces of each tooth. This means the outer surface in blue, then the inner surface as shown by the yellow arrows, and finally the chewing surfaces in green. Each surface has to be brushed long enough for at least 10 counts to effectively remove the sticky plaque bacteria. Usually takes at least 2 minutes to complete the whole mouth. While you get your child to open wide, while you brush the inner and chewing surfaces for the outer surfaces, you can get them to gently bite down instead. This way, the cheeks are more relaxed and stretchable to allow more room for the toothbrush. As children's mouths are small, it will also be useful to use your finger to pull the cheek and lips aside so you can see where you are brushing. This toothbrushing demo video is cut short and fast forwarded, but you can see that I start with the upper jaw, and more specifically the upper left outer surfaces, brushing each area for 10 counts. Then I move from the left to the right till all the outer surfaces are clean. I pull the cheek aside to better reach the outer surfaces, and next I move to the inner surfaces of all the upper teeth. Before brushing all the chewing surfaces. And then finally, I repeated the above steps for all the lower teeth. Note how I put the toothbrush bristles just at the gum line so that we can brush the whole surfaces of the tooth. This is very important. We understand that a young child may not be always very cooperative for toothbrushing, especially in the first 6 to 12 months when you first start doing it. For effective toothbrushing, you need to position them well. In this first picture, the child was standing up and leaned his head backwards onto my lap. In this position, looking down into his mouth, I can tend to see his teeth better. However, for the younger child, the position shown in the second picture might be more suitable. The child is lying on the floor and onto your lap. You can also get your spouse involved to hold her legs and then distract the child, such as singing to the child. You can then concentrate on doing the toothbrushing. This way, you can also make it a fun and bonding family activity by involving both parents, grandparents, or even siblings to help. It is important to brush even if they're not liking it at the start. Just like how some children doesn't like to change diaper or shower initially, most of them get used to it. So likewise, if their teeth get dirty, we need to help them to clean them. We just need to be consistent and patient. Of course, as with training for other good behaviors, it pays to reinforce such desirable behaviors with rewards, stickers, hugs, praises, and kisses, just not with sweet treats. Moving on, next section is on eating well with a healthy diet. A healthy diet is important for your child's teeth and body. For infants, breastfeeding is recommended as the first choice over formula feeding. Breastfeeding exclusively for the first 6 months is advised. It can be continued if desired till 2 years of age, even after introduction of solids. If for some reason a child is formula fed, it's recommended to change it to plain, fresh, or UHT 100% whole milk after the child has turned 1 year old, along with a well-balanced diet, unless medically advised otherwise. Also, one common issue is to let children fall asleep while still drinking from the milk bottle. This leads to the sugars from the milk coating the teeth the whole night. It is best if you can brush your child's teeth after they have drink milk and only drink water after that. If they are using a bottle, introduce drinking from a free flow cup from the age of 6 months and wean the bottle by 1 year old. Sugary snacks like chocolates, gummies, and sticky sweets not only may result in obesity risk, but also put teeth at a higher risk of tooth decay and should be only given rarely, like once a week. You can let your child try healthier snacks like cheese, nuts, fresh fruits, and plain crackers. Be a savvy parent and always check the ingredient list on your food. Beware of hidden sugars, including so-called natural fruit sugars, which can be high in content in foods such as dry fruits, or the other sugars with alternative names such as glucose, corn syrups, and so on in common foods such as cereals. So when is a good time to bring your child to see a dentist? You should try to bring your child to see a dentist after their first teeth have come through, and latest by 1 year old. Even though they may not have their full set of teeth yet, the dentist will check and advise on the proper ways to take care of your child's teeth. Your child will also be able to slowly get used to the dental clinic environment and be less anxious when they are older. Bring them to the dentist only when they're having toothaches or dental problems can cause unnecessary stress and lead to an unpleasant visit. Don't worry if at the first visit your baby is not very used to us. They usually get better over time. During a dental visit, the dentist will check your child's teeth for any problems, teach you how to brush your child's teeth, and give you personalized diet advice on how to prevent tooth decay. He or she will also recommend a suitable toothbrush and toothpaste for your child. According to the child's needs, follow-up visits will then be arranged. Finally, to conclude, we have some takeaway tips to summarize today's sharing. Toothbrushing 1 through 3. Number 1, brush your child's teeth with a toothpaste of at least 1000 ppm fluoride 2 times a day and for about 2 to 3 minutes each time. Bring a child to a dentist before 1 year of age, and subsequent reviews are usually at least 2 to 4 times a year, depending on the risk level of your child that your dentist has advised on. So prevention is best to avoid complex dental issues, excessive dental treatment, and even general anesthesia. And with that, thank you very much for listening. And I leave you a few links here on further information on how to take care of children's teeth. A big thank you to the team, especially Dr. Che Puiling and Dr. Melissa Kaur for helping with this talk. Thank you very much indeed.